high priority cow groups, right? Those animals that might be in a higher, they might be in a higher risk of having an exacerbated inflammation, right? So always keeping in mind that concept that inflammation is good. Inflammation is bad when it's exacerbated, when it's too much, right? Because inflammation is needed. We need inflammation around cows.
All right. Well, welcome everybody to this episode of the Dairy Podcast Show. I am your host for today, Gail Carpenter. And I am joined today by Dr. Adrian Barragan from Penn State University. Dr. Barragan is an extension veterinarian and associate research professor within the Veterinary and Biomedical Science Department in the College of Agricultural Science at Penn State. He's originally from Argentina. He completed his DVM in 2010 at the University of La Plata in Argentina. After graduating from vet school, he practiced as a beef cattle veterinarian on feedlot facilities in Argentina before moving to Colorado, where he worked as a veterinarian and researcher on a large organic dairy. Afterwards, he pursued graduate training at The Ohio State University, where he completed his master's and PhD degrees. He's involved in extension and outreach activities and field investigations, as well as developing and performing applied research to help dairy producers. His active research lab focuses on developing new disease preventative practices to improve cow welfare and fertility, and developing better training and management programs for farm employees and dairy operations. So a lot we could talk about today, and you've been on our show before, so some of our guests will have remembered you talking about some of these topics already. We were actually talking before we started performing that you're getting ready to get started on some of these field trials for the summer, and about how summer's where we really buckle down and start collecting a lot of this data. So to kick it off, I think when I hear your name and a lot of the research that you're doing, I kind of think about, because this is my bias, I've done some research in this area as well. I kind of go towards the inflammation and the NSAID anti-inflammatory work that you've done. So do you want to kind of set the stage and talk about what is your research interest when it comes to inflammation in the transition period?
Yeah. Well, thanks for having me again, Gail. And I feel like we should have shortened the introduction because probably everybody remember from a couple months ago when we did the first one. But
it's been more than a couple. Time flies. It has been a while ago since we last chatted, so people might not remember.
September or November. Yeah, that's true. It was last year actually. It's crazy. It's already May, right? Almost
Time
May.
is a soup. Yeah.
Yeah. Anyhow, so well, thanks again. I'm happy to be here, and I'm trying to just touch base on different like a different area that we talked in the first podcast, because the first podcast we really talked a little about the history of this anti-inflammatory management, sort of the postpartum approaches, the timing, and whatnot. And I was just going to take a different direction based on new findings that we're getting. I think back in September, we still did analyze some of the data that we got from last year trials. And now during the winter, we have done some data curation and data analysis, and we have come out with some really interesting results on those, the concept that I introduced the last podcast about the high priority cow groups, right? Those animals that might be in a higher, they might be in a high risk of having an exacerbated inflammation, right? So always keeping in mind that concept that inflammation is good. Inflammation is bad when it's exacerbated, when it's too much, right? Because inflammation is needed. We need inflammation around cow. And with that being said, some of the main groups that they're popping up, that some of them already, we knew about it, and you might have heard from me about it, like the first lactation cows, those heifers that become first lactation right after calving, and the overconditioned cows, right, 375 and higher. But now we're having some really interesting results on cows that have twins. Basically, a cow that has a twin, and we measure the nice thing of the data that we have. We measure inflammation 21 days before calving, 14, 7 calving, and then 7, 14, 21. And the really interesting finding on this data is that when you see before calving, the inflammation level of those two cows, the cows that have singleton and the cows that have a twin pregnancy, they're exactly the same. But after calving, those twins, man, they just go way up, and the singleton ones stay down.
Hmm.
And really, that's really interesting to see because we already know that we don't like twins, right?
Right.
But, I'm an extension vet, so I do a lot of field work. When I go to the field, it's not that common to see that producers will aggressively manage those twin pregnancies, right? Early diagnostic, early termination of pregnancy, rebreeding animals, right? That is the approach that we want. So ultrasonography of palpation, but yeah, sort of that aggressive approach to identify twin pregnancies, terminate those, and rebreed those animals, right? And so quite often we have twins, right? But no, this data is sort of telling us that those animals might be good candidates for some intervention around calving to try to modulate that high exacerbated inflammation they have in the first week after calving. So that's one group that just come out of this new data that we had it as an outcome variable that we were interested in looking, but we didn't know until now. And the other interesting one that has like a biphase inflammation is the cows that have stillborn calves.
Oh, okay.
And interestingly,
is that a cause or an effect?
That's the thing, because what we're seeing is like we have I say it's a biphasic inflammation. So if we have calving right here, we are seeing a peak of inflammation around between 27 and 21 days before calving. Then it flat out. And after calving, we have another peak around the first week. So really interesting pattern, inflammatory pattern. And logistically, when you think about intervention,
right,
we probably cannot do anything about the first peak of inflammation, because how do you know, right? How do you know the cow's going to have a stillborn calf?
Yeah.
We don't, right? Or maybe we have to focus on that. How can we predict stillborn calves?
Natural Biologics is using cutting-edge science to deliver cost-effective solutions for the animal health and productivity challenges you face. For conventional or organic production systems, Natural Biologics can help support rumen health and immune function, mitigate pathogens, and increase production efficiency. Visit naturalbiologics.com to learn more.
So that 21-day, because you said you don't see that in twins, right?
No, exactly.
You don't see any difference before in calving in twins. So that inflammatory response that you're seeing 21 days before calving, is that an effect of having a stillbirth, or is that a cause? Right? You probably don't know the answer to that question. Probably nobody knows the answer to that question, but can you hypothesize? Is it?
Yeah, I guess it could be either way, right? We know the twins is associated with dystocia, although in this data set we have a really, really low dystocia rate, which was a shame because we really want to see, we have from previous study that dystocia behaves in the same way, like there's no inflammation before calving, everything normal before calving, and after calving is when we have that increase.
That was going to be my next question too, is would you see a same pattern for twins and dystocia? But
it is similar. However, on twins, we have seen like a higher, which is interesting. And my guess is that because dystocia can have several reasons, several causes, and some dystocians could be a little milder than others, but twin is always going to be the same impact. Right. So that perhaps might be the thing, but there are two different data sets, and that also have to be taken with cautious. But regardless, the pattern is really well and really similar. And when we think about the intervention, the applied intervention for this group of animals, we start, or at least my thought process and how, because I always have an extension component from my applied research. So when it comes to, what recommendations can we come out of this data, is that we probably will be grouping these three categories, dystocia, stillbirth, and twins, as calving disorders. And those animals might be the good ones, the good candidates for that postpartum intervention, like right after calving, that approach that we did with two anti-inflammatory treatments at calving and 24 hours later. Now, we tested that on dystocia and multiparous cows, and that worked good. Now I had to test it on twins and stillborn, right? And that's going to be challenging because incidence-wise, those are very, very low, right?
Right.
So I'm thinking on doing perhaps a meta-analysis when we combine because we have done already like 7 trials on these lines. And some of the treatment strategies, they're really similar. But some of them they're identical. So we'll see. But at least for the extension component, that will be a pretty accurate recommendation when we think about the high priority cow groups and what to do about it, right? Because that's the thing. Okay, we identify them. Then what we do, now what we do about it, right? So when it comes to anti-inflammatory management postpartum for cows that have calving disorder, I think that aspirin or meloxicam is a good option as well. And of course, always if we have producers listening to the podcast, always work with your veterinarian, because these medications are extra label use, and you need to have a BCPR and you need to have a veterinarian staff in order to be able to utilize these approaches, right?
Yeah.
But anyhow, so I think that perhaps the newest data that we have when it comes to the anti-inflammatory management, the inflammation, and sort of these high priority cow groups. And one thing that we're about to start now in the summer is we're going to start even earlier than the 14 days approach that we did before calving, and we're going to start treating at dry off.
Oh, okay.
We're going to look for different groups. We're going to look for cows with high somatosal counts, with cows with high milk production at dry off. I don't know if you're aware of that. The study from Dr. Pascottini lab, where they found that the cows that were dried with producing 15 kilos or more at dry off, they have a high inflammation and lower immune cell concentration for up to 3 weeks after drying. So we're going to be looking if this intervention, we're going to be doing the same approach, one dose, one treatment, the same dose, pretty straightforward, and we'll see if that will have any positive effect on these high priority cow groups at that time. That might be different, right? So we're going to be looking for high somatic cows, high milk production cows, lame cows, and other factors, but factors that can be identified on the farm. That's going to be the key. Something that the producer say, okay, yeah, I can look at the records and make a group of all the animals that have lameness recorded or has somatic cell count higher than this. They're going to be separated, or they can be somehow, grouped, and then we can do the intervention. So that is easy to apply and is logistically appealing to the production setting, right? To the farm setting.
How are you timing those samples then? If you're looking all the way back to dry off, are you doing like a before and after, and then every once a week?
Yeah,
this is probably way too into the weeds for most of our listeners, but I'm curious.
Yeah, it's going to be interesting because we're going to be measuring activity. So we're going to start a week before dry off.
Okay.
And we're going to collect a blood sample then. And then after a dry off and the first week after dry off, we're going to do daily samples. And then after that week, intensive bleeding right after the treatment and right after dry off, we're going to do weekly up to 21 days in milk. Okay. So it's going to be really nice data set, not only because of the treatment, but even the placebo, sort of the normal patterns of the cytokine. We're going to be looking at interleukin 1 beta, interleukin 6, TNF alpha, aptoglobin, all these. That most of the data, we don't have much yet on that. Mm-hmm. We don't understand much yet on that physiology. So I think that even that physiological component is going to be very, very valuable to the industry, just to understand more about how these, the inflammatory patterns look in different groups of animals.
Very cool. Yeah, I'm excited. We'll have to have you back on again just to talk about the results of this. So I want to talk about these high priority groups, though, because we mentioned multiparous cows, obviously going to be high priority. Would you consider... you have a cow who has twins or has dyssocia, but she's a first lactation cow. She's going into her first lactation. She's a heifer. Are you still going to put that cow into a high priority group, or is she going to be low priority because this is her first calf?
Well, that's a good question, because one thing that we're seeing is that some of these categories, they're overlapping. Mm-hmm. When you think about the previous categories that we have identified for the prepartum treatment, that is those nulliparous cows become first lactation cows and the overconditioned cows. Those animals, if we think about it, like around 60% of our heifers are overconditioned.
Yeah.
So we found benefit of treatment, on fat cows and also in primiparous cows, but there's gotta be some overlap in there, which logistically it might make it easier to do, okay, just treat the primiparous cows, which are the fat cows, by the way. So it's easier logistically, and it will decrease the number of animals that you might have to treat. Because, I mean, in the study, if we think about how many multiparous cows over condition, it probably was about 10-15%. It was, it's not common to have fat and multiparous cows prepartum. With good reproduction, right? If we have poor reproduction, that's a vicious cycle. It's hard to get out.
Yeah.
But with good fertility, good reproductive performance, is not common. So yeah, it's gonna be some overlapping, and that's perhaps some of the more molecular research that we have to do about, like, what is the weight? Which factor or which feature, for not having a better word, of the animal might have higher impact on the inflammatory patterns that we're seeing. Is it being a first lactation cow, or is being a fat cow, or what is a higher player on that situation? And maybe that can help us to be even more selectively, right? In the previous episode, we talked about, like, we are driving away from the highly hands-on, highly interventionist monitoring approach.
Yep.
Now we're
Yep.
so now we have to be more selective about what type of intervention we are going to do, because we're trying to do no intervention, right? No human intervention.
Right.
So, that research will allow us to even narrow down more to the groups that really need the intervention, right?
Well, maybe that's a good segue. I don't want to spend all of our time talking about, I do want to spend all of our time talking about inflammation, but I did promise that we'd get to a second topic here too. One of the things that you mentioned when we were talking about topics beforehand is uterine disease diagnostics and treatment. You just got a manuscript accepted in the veterinary journal that rocks the boat a little bit, it sounds like. So what was the project? What did you find? What should we be thinking about when we're diagnosing uterine disease?
Yeah, that's a study, and it was interesting because that study, we basically assess a treatment for metritis, which is something that I really wanted to do since 2012, when I collaborated on a research study with Gustavo back in Colorado, where we did intrauterine dextrose in endometritis. All right. So endometritis is only a local inflammation in endometrium. There's no clinical signs. It's fairly mild disease. Some people don't even treat them. There's a high self-cure rate. So what I'm trying to do is it's a very mild condition, but it still affects fertility, right? So in this previous study that we published in 2015 in the Journal of the Science, or 16, some of those years, we actually found that the treatment improved fertility on improved cure rate. We compare it to nothing. So improved cure rate, which we have our goal, but also improved fertility, which I think it was the best, the more significant result from the research. So I always wanted to try it on metritis, right? Clinical metritis. And when we think about metritis, it's a little more severe condition. We have the 3 layers of the uterus affected, not only the endometrium, but the 3 layers quite often become systemic, with systemic signs such as fever, anorexia, dropping milk, and so on. So we developed a protocol, a little more intensive than the one time. I believe that we did 120 cc's infusion for endometritis. So we developed a more aggressive and a longer treatment protocol, where we treat the cows 3 days in a row with 1 liter of 50% dextrose solution, right? So basically what we did, we diagnosed the cows as 7 ± 4. So that was our diagnostic time. Cows that had metritis, they were randomly selected to the septia-4 approach. So basically 2 doses, 72 hours apart. And that was based on the label of the actual medication. And then we compare that to our dextrose intrauterine treatment, which was, as I said, 3 times in a row, 1 liter of 50% dextrose. And one concept that I want to make is that we will, before infusing, we siphon out as much as fluid as we could, just to try to not get too delicate, because that perhaps is the biggest challenge when it comes to these intrauterine treatments, because it's so much volume. Sometimes we have gallons and gallons of putrid, fluid.
Yummy.
Yeah, exactly. Well, luckily it's far enough from lunch, right?
Yeah. Should put a trigger warning at the front of this episode.
Right. But no matter what you put there, especially with dextrose, you might just be feeding bacteria, right?
Oh, yep.
And just linking this study with one that we published a short communication in the Journal of the Saying Communication, we did a similar approach, but we tried to prevent metritis, where we assess vaginal discharge around 3 days after calving, and we infused 1 liter of dextrose. Right? The cow was totally normal, nothing wrong, right? The vaginal discharge was normal. There was no sign of any other disease, but we infused this to see, okay, maybe with this intervention, we will have a lower rate of metritis. And it was the opposite. We actually were causing metritis, which was very interesting to see. And probably that was one of the reasons. So basically most likely we have a small population of, we always had contamination, right? We know that. The uterus always get contaminated around after calving. So that bacteria that is there, if we put in a 3-4 gallon volume of lochia, right, or even if normal fluid, that bacteria that is just contaminating at that point is not infecting, is not colonized. We're just feeding them. And of course, they will grow and they will reproduce and cause metritis. So naive from us to think that 1 liter, and I think that might have been a dilution effect on that study. But I think it was a good study because now, it really set the line on, preventative dextrose is not a good option to utilize. We think about the probiotic studies, the intravaginal probiotic studies have been published. And that's what we came from with this dextrose. Okay, can we use a sort of it wouldn't be a probiotic effect. It's different, right? Because we're trying to kill the bacteria. But could have been used in that matter as a preventative. And it didn't work out. And I think it still was a great study to get out there.
Yeah, that's really interesting. And I think it kind of goes back to something that you just mentioned a minute ago about we can get over hands-on with these transition cows and do more harm than good if we just let the cow handle it herself. Maybe we don't give them enough credit sometimes for being able to handle it on their own.
Exactly. I mean, this study is, we did like 5 years ago or 6. So even back then, I feel that we still were like a little more thinking of interventions, and now it's really like we have to think about just let the cows alone a little more, right?
Yeah.
And just provide the environment that they need.
Yeah.
But jumping back to the study, so don't branch out too much.
Oh, sorry.
Oh, that's good. That's good. But I didn't want to lose the line of thoughts that I was going to. So by comparing these two studies, we also did some overall comparison of the different vaginal discharge scores. When we diagnose clinical metritis, we usually doing a 5-point scale scores using the Metritis, and there are some many studies that have been published, and the scales are very different all over the place. Actually, a review now 2 years old where they analyze all these different scores or scales developed. And we stick with the one that we have used since 6-7 years. Is also a modification from some of the one previously published from Sheldon back in 2008. But in this scale, we have the 1 clear, we have the 2 less than 50% pus, we pass or purulent discharge. We have the 3, which will be more than 50%. Purulent discharge, but it's only purulent discharge. The 4, which will be the red, brownish, watery discharge, but it's not fetid yet, which, interesting, we have a lot of those animals. And that is what I really want to focus on that group, because it doesn't smell. And I have students there, and I have lab technicians. So, every time that we have one of them, okay, everybody smell. Let's make sure that I'm not just making this up. It doesn't smell, right? And one study perhaps that I have to do is like how many of those cows develop into a 5 which is the red brownish, watery, fetid, putrid, score. So interesting with this approach is like usually that 4 wouldn't be considered metritis. It's only the 5. If it's not fetid smell, I don't want to hear anything about it. And I have many reviews that will come back to me, reviewers that will come back to me and say, no, the 4 is not metritis. And I say, there's something wrong with these cows. This is not normal. I agree it's not a 5, but it's not normal. So what we did in this study, we assessed aptoglobin, BHB, body condition score, milk production, and rumination on those three groups. 5 groups, but we group 1 and 3 together because those are really similar, and we have some previous study published that sort of allow us to make that conclusion. But really interestingly, the ones were the ones that have everything really good, really normal. So aptoglobin was low, BHB was low, body condition was high, rumination was high. 4 was different than those 1 to 3. Was high inflammation, high BHB, lower rumination, lower milk production, because we look at milk production as well.
Yep.
But the 5s were the one that were even worse than the 4. So we have 1 to 3 totally normal, 4 abnormal, 5 really bad, right?
Okay.
So these data really allow me to conclude that, hey, we were right. This 4 is not normal. It's really different from 1 to 3, but it's not a 5, but it still is abnormal.
Yeah.
And yet we don't do anything about those animals, right?
Yeah.
And now the question is going to come out like, do we need to do something? Because now we know that 50% of the calves that have metritis self-cure, right? So we have some data on that has been published. So we know that so now will be how many of these animals will self-cure. But going back to the study result of the treatment, because we look into the 2 groups. So what about the cows that have a score 4 and 5 with dextrose or with Septiofur? And basically, the take-home message was that dextrose was a really good alternative for the score 4s, but it didn't work as good for the score 5, especially when we look at milk production. For score 4, dextrose and Septiofur both were able to increase milk production to the levels of the normal animals by 15 days in milk. But score 5, only Septiofur, the milk production went back to normal, and the dextrose was low for a long time. We have data up to 150 days in milk, and it stayed down.
All right.
So with that being said, when you think about different management farms, like organic, for instance, this protocol, this intrauterine dextrose approach might be very beneficial for them to utilize in at least in the score 4s. And of course, there are other infusions that have been proven to be efficient also for metritis, but it's an extra tool that could be included now into the toolbox, right?
Very cool. Well, I know we're kind of getting towards the end of our discussion right now, but do you want to just recap, if we have any producers listening or consultants listening who are interested in this, what are you recommending right now for metritis protocol? When are you diagnosing? How are you diagnosing? How are you recommending treatment?
Yeah. No.
What's your elevator pitch?
So we're diagnosing. We know that metritis is 4 to 21 days in milk, but most of the animals would develop between 4 and 10 days. That is sort of the high, and there's a really nice study from Clips Gavao, Dr. Gavao. He actually looked into diagnosed animals, and they found that in those 4 to 10, 4 to 12 is when most of the cows, if they develop metritis, going to be in that frame. So my recommendation is to do one screen of the animals, perhaps starting once a week, especially if they don't have much issues with the disease. All the animals that are 4 to 10 days in milk, right? 7 plus minus 3. And then just be more selective when it comes to the treatment. If you have an animal that have a vaginal score 4, so we're talking about red brownish, watery, no fetid smell, just do a dextrose. It's like a third or even less than a third of the cost of an antibiotic treatment. Plus, on top, we have the benefit of decreasing, or at least helping to decrease some of the antimicrobial resistance that is a big hot topic these days. And then the FIs, I will say just go with antibiotics, because I cannot recommend to use dextrose on those because our data does not support that. One last comment that I want to make is that when it comes to cure rate of the animals, they were really similar. However, we didn't have the statistical power to make a conclusion on that. Even the p-value were not different, right? Because we're looking for being similar, but we didn't have the power. We're really underpowered, so we cannot make any conclusion on that. And I wish we'll have a couple hundred more animals to actually make that. But the data on milk is really telling us that it's something that's the antibiotics doing that the dextrose is not, right?
Yeah.
So based on that data alone, I'm recommending to not use the dextrose approach for the FIs.
Short and sweet. Sounds good. Well, thank you so much for sharing. It's exciting to hear that you're keeping busy and have some new applied work coming out, and looking forward to hear about your next projects as you get those results.
Oh, great. And always happy to be here, Gail. And again, thanks for the invitation.
Oh, I'm not kicking you away yet. Don't worry. We have to do our 3 questions.
Right. That's true.
Yes.
Yeah, I was forgetting about that.
It's time for our famous 3. Expand your feed possibilities with a trusted partner. You can count on Schooler for consistent, high-quality feed ingredients with reliable delivery. Access an extensive portfolio of product options that fit your unique rations and cost parameters, and get the essential nutrition solutions for your herd at all stages of life. Visit schooler.com/feed to learn more about the benefits of working with Schooler. That's Schooler, SCOULAR.com/feed.
All right, and you've done this before, so you might keep your same answers or you might change them. But the first question that we ask everybody is, what is your favorite dairy-related book or resource?
Yeah, I would say that those still are the same. I haven't changed much of that. The Journal of Dairy Science, some producer magazines such as the Dairy Progressive magazine, and those really... they have a lot of applied information. And actually, I have some, I usually have a couple articles a year in those magazines, which are, part of the extension work. Mm-hmm. But those, the Journal of Dairy Science and the Veterinary of North America volumes that they can, every 2 or 3 years, that they will update us in different areas. So that's still my to-go when it comes to dairy information.
Yeah, good choices. All right. And the next one is going to be, what is your favorite non-dairy related book or resource?
Yeah, and we were talking about that earlier because on the past podcast, I talked about some of these ketogenic diet books I was reading. But one thing, I was in a conference in January, and they have a keynote speaker that he's a veteran, and he's now has a company about leadership and improving leadership at the organization level. And it was a really great speech on how he associated some or relates some of the concept of being in war with the actual stress related to work setting, right, and work environment. And he wrote this book that is called The Stress Effect. And he's Henry Thompson is the keynote speaker and the author of the book. So I was intrigued, and I didn't read it. I listened to it because I had the audio. And it was really great information about how to cope with high stress situation as a leader, right? Okay. So different skills, different techniques that can allow you. And I think that when it comes to our producers, like information like this is really valuable because we are in those situations like on a daily basis. Yeah. Like we're in the cropping, we're working on the crops, and one of the machine breaks, and we gotta finish, and there's rain coming, and like that thing is on daily basis, I believe. Yeah. And this book provides a lot of great tips to help us cope with that, techniques and skills, and breathing techniques and different mind practices, like to sort of improve your mindset or your way to think, or to react to situations. So anyhow, that was my latest read. I finished it like a couple of weeks ago, and it was a great read. I really enjoyed it. I took a lot for personal and professional life out of it.
Very good. I'll have to add it to my Goodreads.
You won't regret, I tell you that.
And the last question is going to be what sets successful dairy professionals apart from those that are not successful?
That's true. I don't think that changed either since last. I think that she's challenged the status quo. She's get out of the box. Look the whole picture.
Yeah.
Sometimes we focus, and I learned this. I'm learning this as I go, because after I finished my PhD, I feel like I was so narrow sighted. And I understand that we just gotta look broader and broader and broader, and just look for before, right? Like even when I think about as a veterinarian, we're trained to treat disease, to treat a sickness, but we had to look way before that. And even when we talk about inflammation, right? And these high priority cow groups, and what is causing that? Why these cows, as you say, is a cause or is an effect, right? When we're talking about twins, but why? Like, overcondition, right? Why? Or what is causing that overcondition? I think that one of the biggest challenge and main issues that we have in the States when it comes to dairy farming is overconditioned heifers. And how, if we can find the key to not have overconditioned heifers, I think it will solve like half of the problems that we have with cows and health and fertility and production.
Yeah. Well, good. It sounds like you're keeping busy. Sounds like you have some exciting new things coming out. If people want to keep up with some of the stuff that you're working on, where should they find you?
Well, I gotta probably say now that I upgrade and update my LinkedIn page. So now it's up to date, and I try to post something on weekly basis. Thanks to your recommendation, Gail. So thank you so much.
Oh, thank you.
So now I had it up to date and posting all the stuff there. So LinkedIn will be a great source, and that all our latest research, latest extension work, and trips and stuff like that are there. And if not, in the website of the department, there will be also my latest research. They're actually pretty good updating that, and also my contact information. So always happy to chat either through the phone or through email. I really like the phone calls more than the emails, but either way works. Please reach out. Always happy to talk and to hear good stories, good experiences, and new challenges.
Yeah. I always tell people you can call my office, but that doesn't mean I'm going to be there.
Right. Well, I usually give my cell phone, and that is a dumb thing to do from my end, but I think it's a passion-driven sort of approach, and I always trust that whoever calls is because they really need the advice, and I go with that, because I'm never in my office, and
right.
Like we're always either teaching or in the field or outside, traveling. So
yeah.
Email or cell phone. That's the way this is going to work.
All right. Well, thank you so much for joining us again. And thank you, everybody, for listening to this episode of the Dairy Podcast Show.
Thanks again, Gail.